Could frequent on-site COVID-19 screenings at the workplace be a part of your return to work strategy? Could it create safer work environments and minimize downtime, disruptions, and risk? I'm Liz Holmes, Associate Broker at the Rockland Organization, and that's what's coming up on this installment of The Stew. Because checking temperatures alone is not enough, due to the possibilities of infections from asymptomatic cases, NDS Wellness provides a number of COVID-19 screening services, including antibody testing, nasal swab PCR testing, temperature screenings by medical professionals, symptom questionnaire screening, telemed services, as well as a tracking and monitoring software platform.
Okay, good morning. My name is Elizabeth Holmes. I'm an associate broker with the Rockland Organization, and I am joined this morning by Ray Lankin, who is the managing partner at National Diagnostic Services of New York. We're going to be discussing resources for businesses that would like to return to the workplace. And the issue right now is how do they do that and do that safely? So good morning, Ray. Thank you for joining me.
My pleasure. Good morning.
I just wanted you to provide us with some information about NDS, also your role, the services that you provide, and the locations that you serve.
So NDS is a national company. It's been around for about 25 years. And the main focus of National Diagnostic Services is chronic disease management. And we deploy advanced diagnostic imaging into hospital networks settings, and we mobilize internal medicine clinics and bring them into municipalities and corporation clinics for annual wellness visits, biometric screening, and other chronic disease such as cancer screening and cardiovascular screening as well. So my role in the company is I'm a managing partner at NDS of New York, and we cover the East Coast territory. We've been operating here our traditional business since the start of the pandemic, and obviously pivoted into providing COVID testing for some of our existing clients, and onboarded some new clients who wanted to create a safe work environment for the employees.
Mm-hmm. And what are the different types of COVID tests that are out there, and what types do you actually provide?
Since pandemic started, and obviously it was a brand new territory for everyone. It was a lot of different tests that corporations were looking to deploy, and I think we're down to one really diagnostic study, is a PCR nasopharyngeal swab. That has a specificity of 99.7%, but there's also other testing available, such as rapid PCR, antigen test, and antibody testing. But I guess coming from a diagnostic background of chronic disease management background, as we went through different projects in the pandemic, we realized that a lot of these tests that offered are not a diagnostic tools; they're screening tools, and because they aim to have about 20 to 25% false negatives and false positive results, and by CDC guidelines, they're all recommended to be if you test positive with any rapid PCR or antigen testing, or if you have an antibody that pops out, like let's say IgG antibody that pops out, it's recommended to be tested confirm the findings with the PCR anyway. So we're really down to one diagnostic tool that's available right now that all of our clients are using across the board, and that's a nasopharyngeal swab PCR.
And in terms of your website, again, some of the information says that you are accredited. What does your accreditation mean? Why is that important?
Our accreditations are with National Accreditation Committee, such as American College of Radiology, Intersocietal Commission of Vascular and Echo Laboratories. This is more applies to our traditional business, where we deploy, let's say, a cardiovascular testing into hospital networks. Like for instance, the clients in the New York metro area are NYU Hospital, Montefiore Hospital, that you might be familiar with. And in order to provide a quality of diagnostic testing for these entities, you're your facility, you has to be accredited with the national committees. So, we mobilize advanced diagnostic imaging such as cardiovascular ultrasound, a lot of MRIs, CAT scans, nuclear labs, and we bring them on site to hospital networks, and manage it and manage the assets for them from there. Another division is a corporate wellness and division that does a lot of municipality work, a lot of work with unions, first responder unions, and that's where you see the trailers on our website. So we build a mobile clinics and bring them into corporation. It's a self-insured corporation mostly, that want to kind of create a health culture for their employees and determine employees that exposed to high risk health statuses, and provide annual wellness visits for these employees and biometric screenings and other medical services. So our mobile clinics go in 30 different states to different corporations such as Quicken Loans, Toyota, GM Motors. City of Philadelphia is our client as well, and provide different medical services.
So have you seen a correlation between offering those services and also COVID testing? Are you offering them together to businesses? We separate COVID screening from our traditional business. Our traditional business we deploy it more into hospital network settings. So to answer your question, more cardiovascular deployment is more in the hospital networks, and with respect to corporation, it's more we're combining it with annual wellness visits. And can you talk about the process if someone were to call you up and say, look, I want to have COVID screenings for my employees? What does that process look like? What is it that they have to do in order to?
Basically, we will set up a sequential testing for corporation. We don't think testing your employees one time, just providing the service one time really works to provide a safe work environment. I think just to test your employees once, you would be wasting your budget, and just it's not really a good way to deploy COVID services. So if we're talking about sequential testing, and a sequence could be every other week or every week, or some entities are more aggressive than others. Some entities do 2-3 times a week. Depends on what kind of business it is. We will obviously set up a day where the nurse comes in. When we come in, we need a small conference room or just a room, table, and basically 2 chairs. A nurse will bring her own PPE and the lab supplies. One nurse can administer about 60 individual, that's 60, in an 8-hour shift. Between paperwork and a nasal swab, we probably spend about 3 to 4 to 5 minutes with each of the individuals. From there, we'll perform the swab, and we set up a lab pickup. So by the end of the day, the individual from the laboratory will come in and take the specimens, bring them into the lab for processing, and basically in the 24 hours, the reports are all pre-populated in the digital web-based report system. And 24 hours with our result turnaround time is guaranteed. However, we've been averaging anywhere from 12 to 18 hours with the resulting on the PCR test.
Okay. And I guess a very important question is, how much does that cost?
Yeah,
if you can get into that, and whether and how insurance plays into that, and private pay, and if you can talk about that a little bit.
Yeah. So with respect to private pay, it's $110 an hour for the nurse to come on site, and it's $115 to process each of the specimen.
Okay. How is someone notified, let's say, if they have COVID at that point? If the test result comes back positive, how are they notified? How is privacy protected? Can you discuss that?
Sure. So reports are all populated in a HIPAA compliant portal.
Okay.
And from there, it depends really on the client. So some corporations assign a dedicated COVID compliant officer to this process.
Mm-hmm.
They will provide all the names for individuals who's going to be participating in the result in getting results from us process, and these individuals are notified automatically after we do initial setup with anybody who tested positive, and obviously the lab notifies the state as well. So
Okay.
so it can be a dedicated COVID compliance officer, or it can be individual portals. So a lot of corporations choose that option, and the portals are set up by the individual themselves. In that case, we send out a little brochure, a little tutorial how to go into our web-based portal and set up your password and login. And in that case, individuals notified automatically as soon as if somebody's tested positive.
So tell me what you think the advantages are of on-site screening, which you provide, versus, let's say, an employee who is feeling symptomatic and wants to go to a lab. And can you provide some insight as to why on-site screening is more valuable or advantageous to a business?
Employee who feels symptomatic shouldn't come into the workplace.
Right.
Just let's establish that,
Right.
If you feel symptomatic, you should quarantine yourself right away and not to come into any workplace or expose other coworkers. This is more obviously it's more comfortable to come into the workplace and get tested if you're asymptomatic on the regular basis. You don't have to set an appointment in the third a fixed standing facility and the urgent care. You have to wait in line. So it's very comfortable. You know that when you go out there, you will come back to your workplace and get tested sequentially every Monday. So it provides a peace of mind for the individual, provides a safe work environment for the employer. Also, a huge difference is the report turnaround time, where an average out there right now, you're working with 48 to 72 hours report turnaround time, where NDS guarantees 24 hours, and again our average is about 14 to 16 hours. So you reported on your results faster, and obviously we flagged positive individuals faster as well. So for employer, it provides a safe work environment when he knows that all the individuals get tested on a regular basis, and and obviously anybody who it tested positive can be quarantined from there right away.
So if we want to provide information on how companies can get in contact with you, I'm going to put some of your information up on the screen, but I do want to thank you for joining me today and providing this information. I think that we'll have ongoing discussions because this is a valuable resource to businesses that actually want to get back to the physical space. So I do want to thank you for joining me today. So.
Of course. Thank you, Elizabeth.
Thank you again, Ray. I appreciate it. Have a great day.